Brammer, this is Shane Brammer, Christy Brammer, and Gina Stahl. How do you respond in an emergency, whether it's major or small? Tonight, let's dive into what a seizure looks like and how to respond to it. What exactly is a seizure? A seizure is a sudden burst of electrical activity in the brain. These can include becoming unconscious, involuntary movements, or blank staring. What are the causes of a seizure? Seizures have a very wide range of what exactly causes them, but some examples are epilepsy, strokes, infections, head injuries, brain tumors, and even genetic factors. Now, when you're having a seizure, sometimes you need that trigger to go into it. So what are some triggers? Triggers can include like stress, flashing lights, hormonal changes, sleep deprivation, and sometimes in children, a fever. So how do you respond? According to CDC, the steps are to follow. You want to remain calm, not only yourself, but for the people around you. You want to keep the environment calm. But how do you remain calm in this situation? You want to make sure you're taking deep breaths and just focus on the person that needs your help. Stay with them. Do not leave them unless you need to go call 911. You want to make sure they're safe. Next, you want to remove any harmful objects around them. You want to clear a space so that way they're able to go through the whole process of having a seizure without entering something else. Like if they jerk and hit their head off a coffee table, that just worsens the whole thing. Next, you want to check for a medical bracelet or medical ID card. So that way, if they have one of these, it can indicate what condition could have caused them to be prone to seizures, what medication they need to take, how much of the medication they need to take, and who to call if nobody's there to help them. Next, you want to place them in the recovery position, which is on your side. You want to have them on their side with their mouth and head facing the ground, so that way if they spit up or foam at the mouth, which is common, it doesn't block their airway and it can just come out and won't go back down, and they can breathe and not suffocate themselves. When they are going through this process, do not try to restrain them, just let them do their thing. Next, the CDC says that you need to track time, not only to figure out how long they were in this, but you need to make sure that if it gets to 5 minutes, you need to call 911 and put in the rescue medication. After this all goes down, make sure you sit with them and explain to them what happened. Don't do it quickly and be frantic about it. You want to go slowly so that way you don't confuse them. And then ask them if you can call family, friends, or anybody to come get them. Make sure you stay with them until they are safe in their environment at the hospital with family or friends. So how do you administer medication? Today I have 3 different types. You have the anal, the nasal, and the tablet. So the anal is mainly for children. This is like an anal injection. You put it up the rectum and you inject it into their system. The nasal, depending on the weight of the person having the seizure, you can either have 1 or you can have 2. You want to make sure that when you do this, you place it just like a nasal spray for allergies into their nostrils and then inject it. So that way it sprays into the navel cavity and gets into the respiratory system. Finally, we have the tablet. The tablet you just put in the mouth and it will dissolve on its own. Make sure you try to get it to the furthest point in their mouth without getting your finger chomped on. You only give them their rescue medication if it's 5 minutes or more. So, from Epilepsy Foundation, they want you to have a plan for yourself, family, or for a peer. You and your family play a central role in your seizure management. Your success relies on being prepared to tackle whatever comes your way. This helps you to have an organized plan and organize all your information about seizure activity and to help to know what to do if something occurs. By being prepared, the fear of having a seizure will not prevent you from living a normal life. So, to conclude, take care of yourself and or others in a seizure crisis requires an action plan so that you are able to take proper care of the patient. Rescue medication, you should know how to use it and when you should use it, and by doing the steps, it will help. And remember to keep calm and worry about the patient. Follow the steps and everything will be okay.